Good morning, everybody, and welcome to the State CDBG-CV implementation session of the CARES Act conference. We're glad that everybody is here early this morning, especially if you're on the West Coast. And this is a session on how we do State CDBG-CV implementation and activities for the CARES Act. I'm Doug Carlson. I am with TDA Consulting. I'm a senior consultant with TDA Consulting. I'm assisted by Randall Mullen, who's the vice president of TDA Consulting. And we also have with us from the Office of Block Grant Assistance State and Small Cities Program, we have Robert Peterson and Corey Schwartz from that office. A couple of logistical things and session topics today. We're going to talk about several things today as part of this session. We're going to talk about the prevent, prepare, and respond tieback for state CDBG-CV activities. We're going to discuss the non-entitlement set-aside requirement in the Federal Register notice for CDBG-CV. We're going to have a brief overview of monitoring for state CDBG-CV. We will also discuss the spending deadlines that are in the Federal Register notice for CDBG-CV and provide a few examples of how to meet that spending deadline. We will also go over a couple of upcoming clinics and topics and other program support options that are available to state CDBG-CV grantees. And then at the end of this session, we will do the question and answers. We encourage everybody who's in this session to ask question and answers in the Q&A button that is at the bottom of the Zoom panel. And we will reserve all the questions for the end of the session and try to take them in order and/or categorize them based on different elements of the questions and what categories they're in. So we'll save all questions for a verbal feedback session at the end of this session, which should be about at least 10 minutes and maybe 10 to 15 minutes. So right now I'm going to hand it over to Robert Peterson from State and Small Cities to do a little introduction, and then we'll go into the session topics. Robert.
Thank you, Doug. Good morning, everyone, especially folks on the West Coast who have joined early. I'm the director of the State and Small Cities Division, so we handle the state CDBG program. And I just want to thank everyone for joining. And we really appreciate the work that you're doing in response to the coronavirus pandemic. We're working our best to get you resources like this webinar to really help in that mission. So I want to thank you for joining, and I'll turn it back over.
Thanks, Robert. So the first session topic that we're going to go into is the prevent, prepare, and respond to coronavirus tieback that's required for state CDBG-CV activities. And I will continue to advance slides, but I will hand it over to Randall Mullen.
Okay, thank you, Doug. The first topic, as you indicated, we'll address is what has become known as PPR tieback. Prepare, prevent, and respond to coronavirus. The CARES Act and the Federal Register notices both require that all activities that are funded with CDBG-CV tie back to your state's plan for PPR. The activities and strategies can focus on any documented coronavirus effect or risk to the overall economic conditions, the services, the housing infrastructure, serving low and moderate income neighborhoods and communities. It's possible, based upon the guidance provided by HUD, for the risks to be both backward and forward looking. Those include both risks and vulnerabilities that you would want to consider when funding activities with CDBG-CV. The forward-looking risks, of course, are more difficult to identify, but uses of CDBG-CV can mitigate those risks, just as, say, tying down a roof limits hurricane damage and clearing brush reduces wildfires. You see that the direct and indirect impact activities that are clarified in the quick guide notice released in April cover a set of 5 activities: economic development, public services, housing, public facilities, and planning. We're going to take a closer look now at each of those individually. Next slide. The quick guide published last April describes examples of both direct and indirect impacts. For economic development activities, a state can provide working capital assistance to businesses to avoid or reverse job loss caused by business closures, or it can provide grants or loans to acquire, convert, construct, or reconstruct commercial spaces. In both of these examples, the state must tie back such assistance to conditions directly caused by the pandemic. In addition to those direct examples, indirect impacts could be deteriorating conditions of the local economy. As indicated on this slide, a state may provide technical assistance or financial assistance to establish, stabilize, and expand microenterprises, for example, to revitalize communities. Next slide. Under the category of public services, a state can provide equipment, supplies, and materials necessary to carry out a public service, where it can provide testing, diagnosis, vaccination, and other health services. In the latter example, the state provides for direct costs of service delivery, whereas the prior example covers the other direct costs that support that delivery. In both cases, though, the costs are tied back directly to the wide-ranging consequences of this pandemic. Indirect impacts here are the side effects of the health crisis and the economic downturn. To address those conditions, a state can increase the availability of daycare, for example, serving low and moderate income areas to enable workers to rejoin the workforce. Or a very popular use is to provide up to 6 months of emergency subsistence payments, for example, rent, mortgage, or utilities, on behalf of a family to prevent their eviction or otherwise stabilize a neighborhood that has been disrupted by the pandemic. Next slide. A state can directly respond to a change in housing conditions, such as overcrowding, by recognizing those conditions that are associated with coronavirus spread, more severe coronavirus disease, and poor cost COVID-related outcomes. How? By acquiring property and new construction of affordable housing funded from another source, or by converting a vacant or abandoned commercial structure to affordable housing. The indirect impacts can be triggered by changes to which building codes and public health advice required, or by constructing affordable housing as part of a neighborhood revitalization project, provided that waivers are considered and approved. Next slide. Under the category of public facilities, a state can make interim improvements to private properties to allow individual patients to quarantine on a temporary basis, or acquire or rehabilitate a motel, hotel, or building for non-congregate shelter, or enable permanent housing where such housing is not sufficient during the coronavirus pandemic or epidemic. Whereas both of these examples clearly address direct impact, a state can also construct or improve parks to provide outdoor fitness and social space that meets social distancing guidance in LMI areas, or rehabilitate facilities to increase ventilation and space for such residents, including seniors or youth, and expand broadband infrastructure to underserved LMI areas. This particular activity is fully explained in a recent quick guide referred to as the CDBG-CV for broadband quick guide. And lastly, on this list is one activity that is of great interest to many states across the nation. It is possible to reconstruct degraded water lines to supply potable water to homes, schools, and health providers. Next slide. Lastly, a state can undertake planning activities to address either direct or indirect impacts by assisting UGLAs with planning activities related to CDBG-CV eligible activities or for planning only activities. Also, under the indirect impact, UGLAs can hire outside support to deliver CDBG training to new subrecipients or a local government that is administering CDBG funds for the first time and during this pandemic. It is, however, important to note that this activity, of course, is subject to the state's administrative cap. Now I'll turn the next topic over to Doug to address the non-entitlement set-aside. Doug?
Thank you, Randall. Just very quickly, people are already starting to ask some questions in the Q&A section of Zoom. So continue to ask those questions so that we can get to them at the end of the session. Don't use the chat, use the Q&A for that purpose so that we can categorize and organize them. One of the first questions that was asked, and I'll just answer right away, is yes, these slides will be provided after the session. They will be sent out to participants after the session. So you will have a copy of these slides from this session, so you'll be able to use them as a form of an outline for your state CDBG-CV program. So I'm going to speak about the non-entitlement set-aside requirement that is in the Federal Register Notice for CDBG-CV. It is in the section noted in the PowerPoint under direct action by states. And it says that the state must set aside a portion of its CDBG-CV funding for use by UGLAs, non-entitlement UGLAs, or units of general local government. And that amount has to be no less than the first CDBG-CV allocation. Grantees are allowed to use any portion of their 3 CDBG-CV allocations for the UGLAG set-aside. They're not required to necessarily obligate all of the CV1 award, for example, for the UGLAG set-aside. They can use a combination of those resources as long as they meet the requirement in the Federal Register Notice. So there are different ways to budget your CDBG-CV funds to meet the UGLAG set-aside, as long as you meet the minimum requirement that's in the Federal Register Notice. One thing to keep in mind, which is actually part of some of the FAQs that have come out on the state CDBG-CV program, is that state program administrative and technical assistance expenditures that are part of the UGLAG set-aside don't count towards the set-aside. In other words, it's only the activity funding or program funding from the state for the UGLAGs that count towards the set-aside. You cannot add state admin and technical assistance expenditures for UGLAGs, non-entitlement UGLAGs, as part of the set-aside amount. It has to actually be an activity-specific amount of funding in order to meet the set-aside. So some grantees may have set aside all of their CV1 funding to UGLAGs, but took out admin and TA expenditures, and so they would be short. There would be a gap in their CV1 funding, and that would have to be made up with the other allocations. So that's a very important thing to consider and think about when it comes to the set-aside. So to carry out the UGLAG set-aside requirement, it can be either done by states acting directly, or the UGLAG may carry out things directly, or they may request that the state can carry out the activities directly on their behalf. So there's 2 options in order to meet the non-entitlement set-aside. It's important to remember, and this is really no different than the state CDBG program, the non-CV state CDBG program. It's really important to remember that an UGLAG must follow the local citizen participation requirements for CDBG, CDBG-CV in this case, as modified by the notice. Those still are required, and those still have to be followed as they're outlined in the notice for the CDBG-CV program. A state in its method of distribution can include the option for an UGLAG to request that the state carry out the activities on their behalf. if they choose. So that is an option for a state in order to modify their method of distribution. They can put in the method of distribution that there is the option upon the request of the UGLUG that they can carry out the activities directly on their behalf. So next, we're going to discuss a little bit about monitoring for state CDBG-CV. I know that this is a topic that has come up quite a bit in my interaction with state CDBG-CV grantees. One of the things that always comes up is, how are we supposed to monitor for these activities? What are the requirements for monitoring going to be? And how do we carry those out and make sure that we meet the requirements of the notice and also just the requirements for the CDBG program in general, which do apply to CV funding. So the direct action by state section of the CDBG-CV Federal Register notice actually talks about states carrying out activities directly. But it also says that the state shall make reviews and audits, including on-site reviews, of any subrecipients in local government as necessary and appropriate to meet the requirements of the HCD Act as amended. That's actually a section that is in the Federal Register notice. And there are a couple of ways that we recommend that states meet that requirement. So when we think about necessary and appropriate, we think about some level of risk analysis for the CDBG-CV program. So a state-based risk analysis for its subrecipients, its UGLUGs, and other recipients, tribes, entitlement communities is part of the process that we recommend should be used in order to meet the necessary and appropriate language that's in the state CDBGs, in the CDBG-CV notice section for states. So that is one area that we highly recommend people use in order to meet the requirement of as necessary or appropriate. So one way that you can do the risk analysis, which everybody is very aware of, is that you have to identify areas of risk for CDBG-CV, in addition to the regular risk areas that would be used for a CDBG program, the experience of the grantee, the number of grants they have that are open, their financial management practices, past monitoring findings, any other issues that you're aware of with the grantee are all risk-based actions that you would want to consider normally under the CDBG program. But in addition to those items for CDBG-CV monitoring, there are other areas of risk that you would want to consider with respect to activities that are funded out of the state CDBG-CV resources. One of those, of course, is the prepare, prevent, and respond tieback that is necessary to meet the Federal Register notice requirements and the CARES Act requirements for all state CDBG-CV funding. And there is a prepare, prevent, and respond tieback quick guide that we will reference and link in the slides that are sent out, that is dated April 30th to 2021, that everybody should refer to because it gives excellent examples. In fact, Randall gave those examples of how you can meet some of those tiebacks to prepare, prevent, and respond to coronavirus. So that is an area of risk that definitely needs to be identified as part of the risk analysis. The other obvious one is the duplication of benefits, or the requirement that any resource not be used twice for the same thing, including CDBG-CV. So considering duplication of benefits for all CDBG-CV assisted activities is going to be an important component of risk analysis. If you know that a recipient or subrecipient is receiving other resources in their community and potentially for the same activity that you're funding with state CDBG-CV, then it would be important to look and make sure that there are no duplication of benefits across those activities. And then last but certainly not least, because it will be coming up sooner than we expect, and we'll be talking about it a little bit in a couple of minutes, is the expenditure deadline for the CDBG-CV program. We'll go into that in more detail, but whether grantees, subgrantees, subrecipients, or other entities, tribes, and entitlement areas are spending their money, whether they're coming close to meeting the expenditure deadlines for their activities, whether they're obligating and drawing down funds from the state in a timely manner, are all things to consider as part of the components of a state risk analysis, along with all the other components that I mentioned before, which most states are very well familiar with. So the other thing with respect to monitoring that is useful and helpful is to have an actual state monitoring plan for CDBG-CV. So that monitoring plan would outline the criteria for remote visits, on-site visits, how the risk analysis is used, how it determines what activities will be funded, how the state will carry out its monitoring over the course of the life cycle of the CDBG-CV program, how many grantees it expects to monitor, and all of the other criteria that would normally go into a state monitoring plan. That plan could follow many of the formats that HUD uses for its monitoring and risk analysis and the exhibits that are used by HUD to do monitoring of CDBG-CV or CDBG programs. And you could incorporate that as part of a state monitoring plan for CDBG-CV. We don't yet have exhibits for the CDBG-CV program, but still the CDBG program has plenty of criteria for conducting risk analysis, for doing monitoring visits, and all of those activities. Last but not least, we want to remind grantees of the single audit requirements that are in 2 CFR 200. There's a $750,000 threshold for any recipient of federal funding to have a single audit conducted under the Single Audit Act and to have that submitted to the database for single audits. So that is something that we want to make sure that states are aware of, depending upon the amount of resource that it's given from the state to a subrecipient or other entity, or an UGLUG or tribe or anybody else covered under the Federal Register notice. The Single Audit Act requirements and the threshold for single audits do apply for state CDBG-CV. So next, I'm going to hand it back to Randall for a discussion about the spending deadlines for CDBG and with a couple of examples and guides for you. Thanks, Randall.
Thanks, Doug. Yes, clearly states can expect HUD to carefully monitor the use of CDBG-CV grants due to the large amounts and these very spending deadlines. We'll turn our attention to the specifics around these spending deadlines. All state grantees must spend their CDBG-CV allocations within a 6-year period of performance. Although that period may seem to be well into the future, it really is not upon closer examination. We'd like you for now to take a look at this timeline that offers an example. First, the period of performance begins when the CDBG-CV agreements are executed. For instance, a state grantee that has executed its first CV grant, CV1, in May of 2020, begins its period of performance at that time. Moving along the timeline, you see that at least 80% of those funds then must be spent by the end of the 3rd year. And I want to stress here that this is referring to all CDBG-CV funds. The agreement would have been executed for not only CDBG-CV1, but other allocations as well. So 80% of the CDBG-CV funds must be expended by the end of the 3rd year of this period of performance. And then you will see toward the end, of course, 100% of the funds must be spent then by the end of the 6th year of the period of performance. So this is a condition of the award of these allocations, and state grantees therefore must recognize the challenge that they face. Next slide. So what is a responsible and well-managed state CDBG-CV grantee to do to keep funds moving along this timeline? Well, states should consider best practices that were actually first identified in a publication years ago by the Department of HUD entitled Keeping Your CDBG Funds Moving. It identified a series of strategies that apply equally as well to the CDBG-CV programs. First, building awareness of the timeliness issue. we must recognize that this period of performance will require that the funds be spent or face serious consequences as a result of failing to meet the spending deadlines. The second is to recognize that a measure of accountability is necessary within the state. So identifying staff that are in a lead position to carry out the responsibilities and organizing around that function of your state government will be key. The third is to streamline programs and project implementation. Doug and I have both noticed that many states have recognized this challenge and have created their programs, designed the delivery mechanisms in such a way that they can more likely spend the money in the timely fashion. But it's also then, after having organized properly to carry out such a large scale program, it's necessary to ensure that your state has the necessary information to track the expenditure of the CDBG-CV 1, 2, and 3 grants. And then throughout the course of this 6-year period of performance, carefully monitor the progress along the timeline to determine if you are on track based upon monthly expenditures or quarterly expenditures to hit the 3-year target for expending at least 80% of the grant funds, and then toward the end, 100% before the period of performance of 6 years expires. Along the way, you will undoubtedly identify problems, and there are some that would be considered incipient in that they present themselves unexpectedly. And at that point, although it's probably one of the hardest things that a state government can do, it must act in a nimble fashion and take action to reallocate dollars to where they can be used effectively to satisfy national objectives and qualify under the CDBG-CV guidance, as well as tie back to the pandemic and satisfy the spending deadline requirements. And then lastly, educating key officials. Many of you are in positions where you might know the right thing to do to keep the funds moving along that timeline and eventually spend them within the 6-year period. But you can't carry out certain actions without your superiors, especially those key officials, appointed or elected officials, who would then approve the action and enable you and your program to meet the expectations for spending the program grants within the 6-year period of performance. Now, Doug will address the next topic on our agenda. Doug?
Thanks, Randall. I had to get my video back on. Sorry about that. So another quick reminder, because we're nearing the end of the session, and what we really wanted to do as part of this session, because we know there's always lots of questions that states have, and we have the director and the deputy director from state and small cities in this presentation. So again, please use the Q&A to ask questions so that we can try to get to all of them before our time is up today. We think it's critically important that you are able to ask your questions during this session. We know that many of you have read the notice and have read some of the other FAQs related to the state CDBG-CV program, and that we're reminding you of that. However, this is the time for you to ask those questions that you either put in the AAQ or didn't put in the AAQ or wanted to get out or have discussed amongst your colleagues during the session today. So please use the Q&A to ask questions. A couple of things about, and speaking of states and speaking of CDBG-CV, there's a couple of things that you should be aware of in terms of support that's available to you for your CDBG-CV program. The first of which that we're still working on developing all the curricula for, but there will be a state peer-to-peer cohort that will be part of the CARES Act sessions that HUD is rolling out, and it's tentatively scheduled right now for September 20th. We don't really have a lot of other information other than the tentative date, but that will be a cohort where we'll have states talking amongst themselves about their CDBG-CV program delivery. It will also involve some training materials and information to some degree as well as part of that cohort. So it'll be part learning session and then part interactive session between states in order to talk about CDBG-CV program delivery and any of the particular challenges that you're having with the program delivery. Another quick reminder, there is an AAQ for CDBG-CV. And states are, of course, can use the AAQ to ask questions. The AAQ is managed by HUD and a group of technical assistance providers. And that is a great way to get some of your more basic questions answered at the state level. And the state program, of course, is uniquely different from the entitlement program. So if you have questions that you don't feel you have the answer to or are unable to work it out yourself, you can use the AAQ as a resource. And a third, there are a couple of FAQs that are on the CV programs that are on the link that are on the HUD Exchange, and a couple of them are related specifically to the state. The UGLUG Setaside is actually mentioned in some of those FAQs, and the admin and technical assistance expenditures as part of the CV1 Setaside is actually in the FAQs as well. But there are also very specific program-related FAQs on the HUD Exchange on that site that's linked right there. So we encourage people to use the site. We encourage people to use the CDBG-CV toolkit that is on the HUD Exchange and other program support options. Last but not least, remember that through the HUD Exchange, you can request limited on-call TA support if you are a state. You can submit a request and HUD will triage it and decide whether or not it will be assigned to a TA provider or not. There's up to 16 hours of TA that can be provided under the on-call TA support. So if you feel that you need more hands-on support, that you want to talk to somebody about your program and work out a couple of the issues related to it, then you can use the on-call TA support. So we're, just a quick reminder, those resources are available to you. Randall and I are answering AAQ questions and working with the state and small city staff all the time to try to give you the TA support that you need. So now we're going to go to question and answers. We have about 14 minutes to do that. So let's get
Yes, and we have a few questions that I think we can immediately direct to Robert and Corey, Doug. The first concerns PPR Tieback, and the question, Robert, is for indirect economic impacts, is it sufficient to document decline in employment or decline in sales tax over the period of the pandemic? Or will HUD be looking for some other documentation?
It's a good question. So, typically—
Can you speak up a little, Robert?
Yeah, can you hear me better?
Mm-hmm. Thank you.
All right. Yeah, so I think this question comes from the nature of tieback when we think about disasters, right? So
right,
a lot of times if a business is flooded, they would be able to receive CDBG funding potentially under disaster allocation, and there would be like a direct tieback that was the affected business. It's a little bit different with CV funding because when there's the economic downturn in relationship to the pandemic, a new business, maybe a business that didn't close during the pandemic, but yet a new business could have tieback because it's creating jobs that relate to the economic downturn. So the data sources that were mentioned would be suitable for that type of a tieback.
Okay, thank you. Doug, do we have another question?
We do. There's a question about, it's actually a really good question. I'll just read it. It's easier to do it that way. When thinking about COVID relief, how can we diversify the levels of care to working class citizens that are experiencing discrimination and barriers to reaching resources, i.e. vulnerable adults in homelessness and trying to access resources? So in other words, how can CDBG-CV, state CDBG-CV, help people who are facing these incredible barriers and are homeless?
I think it's important to keep in mind that with CDBG-CV funds, there's a lot of new opportunities, a lot of new partnerships that could be formed. And even within the framework of the CDBG program itself, there are opportunities to do things as a grantee that maybe you haven't done before. So not only with CV funds do you have more money to begin with, but you also have the public service cap has been lifted. You have 6 months for subsistence payments. And you're also possibly funding types of things that you've never funded before in terms of health services and other things that have been more directly related to coronavirus response. You know, and I would encourage folks to look at, you know, all the possible funding sources that have come and to really put together like a portfolio that's going to suit your community's needs based on the limitations of each funding source, taking into consideration the types of eligible activities that certain funding can take advantage of. Look at the full breadth of what CDBG can really do. Maybe you haven't really taken advantage of that breadth in the past. And also look to new partnerships that can come from that as well. So I hope that answers the question.
Yeah, that's a great answer.
And Robert, we have a question related to eligibility and particularly the effect of rising prices on the economic recovery and a state's ability to support its grantees in undertaking public facility projects. The question is, it begins actually with a statement. We have several of our current CDBG grantees that are having issues with price increases on construction supplies, materials, etc. Projects include water, wastewater facilities, high construction cost. Could the set aside be used for these projects?
I think I need a little bit more information about that. It does sound like the question is, there are projects funded from the annual CDBG program, and there's an interest in using CDBG-CV funding to cover these additional costs that have incurred due to price increases. You know, generally speaking, what's eligible for CDBG is also eligible for CDBG-CV. There's additional requirements with the tieback, of course. And that could be an issue with this particular project. I don't know that just the increased costs alone would be a tieback in relationship to the project itself, because it's not the, maybe the project doesn't have a tieback. The tieback is only in the increased cost, but we would need, generally speaking, I'd need more information, but I do think the answer would be no, that's not, just the increased price is not a sufficient tieback.
Thanks, Robert. So the next question is one I know you know the answer to, because it's in the Federal Register notice for CDBG-CV, and it is, can the state grant CDBG-CV funds to an entitlement city to carry out eligible activities?
They can. As acting directly in the CDBG-CV notice, they can make an award to a variety of different subrecipients. They can use contractors, and the types of subrecipients as well that they can fund include entitlements. And generally, when they fund a subrecipient that's a governmental entity, then that does set up the situation for environmental review, where the entitlement entity would do the review, and then the state would be the one to approve and release funds.
Okay, we also have a question, Robert, about how to charge administrative costs. It seeks to confirm an understanding. And the question is, if an UGLIG is provided project activity cost and administration, the administrative cost does not count toward the set aside. Is this correct? I'll repeat that for you. But
yeah, I got it.
Okay.
Thank you. And just for everyone's benefit, so the we have the set aside, which is the amount that has to be for UGLUG's use, unit of general local government's use. So as a state grantee, when you make those awards to your units of general local government, the question I understand is that if there are project delivery costs that are included or admin costs that are included in that award, so these are admin costs that would be incurred by the unit of general local government, then the answer is that those would in fact be for the unit of general local government's use, and those would count towards the set aside.
Okay, thank you.
Robert. So I'm not surprisingly, the set aside is a hot topic. So the next question is also about the set aside, and it asks for the non-entitlement set aside, is HUD using IDAS to determine the non-entitlement set aside activity amounts, or will the state have to report these in another way?
So we are using IDIS to the extent that we can to confirm that. You can definitely anticipate that it'll be part of the monitoring exhibits in the future. Although those have not been released yet for CV. That is coming in the future, and that would be one of the items that would be reviewed. I do not think that there will be like any type of flag or anything in IDIS, but you can definitely anticipate that it would be a monitoring topic.
And then
Next question. The next question, Robert, is rather open-ended. It asked about national objectives and specifically says, will you discuss national objectives compliance in relation to tieback?
Yeah, so during the presentation, we didn't get into national objective too much, but it's an important point, and I'm glad it was asked. PPR doesn't replace national objective. The activity has to be eligible. It has to meet a national objective. And if we're talking about CDBG-CV, then it additionally has to have a tieback. So good point. Thank you very much for mentioning that.
And then the next question, Robert, is a discussion about risk analysis. It asks if there will be copies of risk analysis templates that can be shared. I know that there isn't something, or I'm pretty sure there isn't something that exists now, but do you have any insight on what might be available in the future?
So we have a risk analysis notice that will be reissued. So that would be the first thing to look for. And you are correct, Doug, that has not occurred yet, but that would be the first thing to look for in the process for monitoring in the coming year. It'll be an updated risk analysis memo. And then, typically we would do risk analysis towards the end of the calendar year, and then monitoring would begin in the spring. So we're on a tight schedule here to get all those resources in place for the next monitoring season.
Yes, indeed. One other question relates to reporting, Robert, and you've already commented once in respect to IDAS, but this question is asking more about the timing of information that would be entered into IDAS. We are funding food bank services and other public services. How often do we need to submit accomplishment data in IDAS for these activities? We're concerned that collecting it quarterly would be onerous and would result in duplicative numbers, and we are considering requiring it annually or during the life of the 18-month project period. Would that be acceptable?
So state CDBG reporting requirements are in fact annual. In addition, our accomplishment reporting in connection with the CAPER is also annual. So if you have a situation where you have 18 months, then it sounds like it would be reported out on 2 program years and 2 CAPERs.
Thank you.
So the next question, and it will have to be a last. Yes, we are sharing copies of the PowerPoint that has again been asked, and those will come out from the contractor in the next week or two. So the last question is, when does HUD anticipate releasing their state CDBG-CV monitoring? We're working on ours and would like to parallel HUD's. I think you answered that, but if you want to reiterate your process that you're developing now.
Yeah, like I said, we're working on that, but I wouldn't necessarily wait for us to work on yours. If you're in a position where you're able to begin that, I think that between the notice and the CARES Act itself, you really do have quite a bit that you can work with in terms of putting that into a monitoring exhibit that you would use for monitoring your subrecipients.
And so there is one quick question. I think we're at time, but one quick question is, what happens if only 60% of the funds were expended by the third year? In other words, what if you don't meet the 80% benchmark?
Well, if there's a finding made, then corrective actions are done on like a grantee by grantee basis, depending on a variety of factors. So it would be something that we would address at that time. We may, HUD may recapture funding. So that is a possibility that you need to be aware of. As a grantee, you should really plan to make that deadline. So that's all I'll say about that.
Thank you.
Well said.
Okay, so that looks like we're at the end of the questions, and I believe we're also at the end of our time for today. So thank you, everybody, for participating in this session. Thank you, Robert. Thank you, Corey, and especially thank you, Randall, for helping me go through these slides. We hope everybody has a great day and continues to attend the conference, and hope to talk to you all soon. Thanks.
Thank you.
Take care, everybody.
Goodbye.